progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Many people mistakenly think that palliative care is the same as hospice care, and so they may be reluctant to seek advice about palliative care. However, it is important medical care that focuses on people who are seriously ill. It's meant to help patients get relief from their symptoms, pain, and stress, whatever their diagnosis. My guest today is Dr. Manjula Vaghjiani. She's board certified in palliative care and internal medicine, and she's a member of the medical staff at Palmdale Regional Medical Center. Welcome to the show, Dr. Vaghjiani. What is palliative care or palliative medicine?
Thank you, Melanie. Palliative care is an essential component of serious illness care, much further upstream than from terminal care. It should be viewed as valuable care component for patients with cancer, dementia, end-stage chronic kidney disease, liver failure, neurological disorders like ALS, severe congestive heart failure, and severe COPD. It's especially true for any patients undergoing rigorous therapy, such as chemotherapy or radiation for metastatic cancer. This multidisciplinary approach is for symptom management, psychosocial support, and assistance in treatment, decision-making for patients and their families, with emphasis of well-being of patients and families at any point along their disease trajectory, regardless of the illness state. Palliative care does not refer to a particular place or a specific stage of illness, but rather it describes a philosophy of care. It is provided by a specially trained team of doctors like me, nurses, social workers, chaplains, nutritionists, and pharmacists who work together with the patient's other doctors and provide an extra layer of support. It typically improves quality of life, it decreases patients' pain, and addresses physical, psychosocial, and spiritual needs.
So what's the difference between palliative care and hospice care?
The term palliative care is often incorrectly used as a synonym for end-of-life care or hospice care. Unfortunately, even well-meaning doctors incorrectly equate these two treatment approaches. Palliative care often offers upstream symptom management. You could get curative treatment along with palliative care. Hospice care is late-stage terminal care, compassionately delivered by hospice agencies. Medicare does cover it as a federally funded program, and hospice program helps patients and families during the process of dying.
So do they have to give up their own doctor to work with a palliative care specialist? And you mentioned that they can have curative treatment together with palliative care. So please tell us how that works together.
You do not have to give up any doctors that you have had a relationship for taking care of you. It is alongside with your specialist, your primary care, and hospice care is further downstream treatment that is also very great care that your patient and your families do need at the end of life.
So if somebody is in chemotherapy, palliative care is meant for symptom management. For what? And how does it work? Is it medicational? Is it mental health and counseling? Is it nutritional? Explain the actual access of palliative care.
So palliative care specialists are especially competent in symptom and quality of life assessment, complex symptom management, communication skills, spiritual assessment, family-centered care, and high quality of life. Let's take for an example of oncologists who are highly trained in treating cancer, but might be less so in managing complex, time-consuming psychosocial issues. We all know that cancer can sometimes be a very painful disease. Hematologists, oncologists often find complex pain management quite challenging and welcome additional expertise in this difficult yet vital area of pain management that is ongoing concern with patients undergoing serious illness. It is certainly not meant to replace care already being provided by a specialist. Palliative team can also serve as an effective communication bridge between the specialist team and the patient. Patient may engage in different conversations with different clinicians. Example, focusing on cancer with the cancer specialist and seeking the curative treatment, while pain and psychosocial distress are addressed by a palliative care specialist. They often express and open up with their palliative care clinician rather than their specialist. The palliative care team provides an extra layer of support and works in partnership with your primary care doctors and specialists.
So who else besides the patient can benefit from palliative care? Is the family involved, doctor?
Yes, absolutely. The family is involved, and family is part of this whole team. The goal is to improve your quality of life. By addressing and relieving symptoms, you can expect close communication and more control over your care. The palliative care team will spend time talking, listening to you and your family. They will make sure you completely understand all your disease, treatment options, and your choices. The team will assist you with making medical decisions as well as prognostic understanding with deeply exploring your personal goals and then help you match those goals to the options. They understand and support your ability to cope with your illness. They may also make sure that all your doctors are coordinated and know and understand what you want. It gives you more control over your care. Your doctors and nurses benefit too because they know they are meeting your needs by providing care and treatment that reduces your suffering and improves your quality of life.
Is there nutritional counseling involved, doctor, with palliative care? And how would that work as far as nutrition and exercise as extra and palliative side-along care to whatever treatment somebody is going through?
This is one of the goals of quality of care. You do not stop doing the exercises that you would like to do. However, with this serious ongoing illness, you might feel weak. You might have not done exercising for a while. So this is a great program which will guide you what is the level that you can start with and how far you can push yourself to do exercising. Nutritional support is also important. We give all the advice on nutrition supplements, what should be taken, what should be avoided. These are all advices that the nutrition as well as the palliative care team can take care of.
And where would somebody find palliative care? How do they go about the process of finding this type of care to go along with their treatment?
So a little bit of background. Back in 2000, less than 1/4 of U.S. hospitals with 50 or more beds had palliative care team. In 2015, larger hospitals, which is more than 300 beds, palliative care teams can be found in estimated 85% of hospitals. In 2006, hospice and palliative medicine was recognized as an official medical subspecialty. There are greater than about 6,500 physicians who are board-certified palliative care physicians and more than 100 accredited fellowship training programs in U.S. And an example is ASCO, which is American Society of Clinical Oncology, recommended in 2012 that concurrent palliative care be offered to all patients with metastatic cancer and or high symptom burden. Most insurance plans cover all or part of palliative care, just as with other hospital and medical services. This is also true of Medicare and Medicaid. If cost concerns you, a social worker or a financial consultant from palliative care team can help you with payment options. And this can be provided for care for you while you are undergoing other therapy.
In just the last few minutes, doctor, what would you like to tell people who are in need of or considering palliative care?
I would say ask your doctor. Ask your doctor where can you find these services. They do also have services as outpatient clinic settings. They also have settings where you can go have a treatment at home. I would like to end by saying that we shall hold your hand and walk you through our comprehensive supportive care. Enjoy your life, no matter how hard it may seem. When life gives you 1,000 reasons to cry, show the world you have 1,000,000 reasons to smile. Thank you.
What a lovely sentiment. And can you finish, please, by telling the listeners why they should come to Palmdale Regional Medical Center for their care?
Palmdale Regional Medical Center is a beautiful center. I'm hoping that some of you have visited as visitors and certainly as patients. It has individual room settings, beautiful scenery, and wonderful, hardworking staff that are there to give you compassionate, caring care for you when you are going through difficult situations and difficult life-threatening illnesses.
Thank you so much for being with us today. You're listening to Palmdale Regional Radio, Palmdale Regional Medical Center. For more information, you can go to palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.